What's up guys, Dr. Dan over here at Beat Fitness. Shooting a quick video on proper use of cell phone, right? So we have probably all read the articles on the dreaded text neck, right? When we are spending so much time these days on phones and tablets, looking down, ultimately we end up completely deconditioned and weak in our mid-back, our core, our neck. We get chronically tight in this fetal position, which is something we grow out of at a very young age. I'm never gonna visit it again, and I don't want any of you guys to visit it again. So let's do everything we can to avoid the neck problems, the back problems, and even the fingers and wrist problems while texting, right? So many of us spend time on our phones throughout the day, and one of the more common things that happens is people's heads start to fall forward. And what happens is that the ear and the shoulder, you're supposed to have a nice upward posture to help eliminate neck tension and back tension, all that good stuff, right? Unfortunately, many of us are like chronically downward, which actually causes a reversal in your normal neck curvature. And what that does long term, it can cause muscle damage. A lot of people are getting chronic headaches, migraines, because your spinal cord is not meant to be stretched in this forward position for a long period of time, right? Easiest thing to work on when you are experiencing neck problems related to chronic flexion, looking down at the phone, is to begin to learn how to type and text throughout the day at more of that eye level phone position, right? The other thing that we have covered in previous videos was giving ourselves that nice thoracic spine stretch, which helps to counteract all this forward flexion-based movement that we put ourselves in, right? A lot of kids nowadays that are 5 years old, 6 years old, are learning to walk, and immediately as they're learning to walk, they're going back into this fetal position, this kind of forward flex position, which is gonna cause a whole host of spine-related problems, musculoskeletal degeneration at an earlier age, and probably rotator cuff problems, hip problems, all kinds of things that we don't even know about because these things have only been around for a little bit of time. So, step one, eyes at phone level, right? So if we're texting, try to keep that head elevated. If you are constantly finding yourself looking down, you have to break that habit. Second easy way, put the phone down, palms up, elbows in, lift that head away from the belly button, squeezing the shoulder blades back and down so we can start to condition those back muscles to hold you upright, right? Those are the two simplest tips. Now, the other problem that people are facing with chronic cell phone use is carpal tunnel related incidences, thumb tendon problems called tenosynovitis, which if we look at the hand right here, we see a couple of tendons pop out. People are texting so much, right? And if you can zoom in on my phone here, Bree, if you see my tendons in my hands working, right? If I'm texting all day long, you see all the movement, even up here in my wrist, you see these little muscles working, right? So tons of patients and even gym members and family members come to me saying, dude, my hands are killing me. Why are my hands killing me? Well, if you're on your phone responding to emails and text messages and different things like that, and you're overusing your little thumb muscle, guess what will happen? Not only will that create compression of the thumb joint itself, it causes strain and repetitive stress in some of the muscles and tendons that are responsible for finger movement. We can also get elbow pain, and ultimately that discomfort and problem can work itself up into the neck, right? So you have a perfect storm of problems when your head is forward, your back is forward, and then you're overusing your forearm muscles. Oh my gosh, talk about nerve compression, tendinitis, elbow problems, rotator cuff problems, and headaches all day long. How many of you people have one or all of those things that I talked about, which are so simple to fix? Exercise one, palms up, elbows in, shoulders back and down. And for the wrist and the hand, I like to do a simple hand stretch where we start off grabbing all four fingers, and for about 5 to 10 seconds, We're just gonna keep the elbow bent, we're gonna keep the shoulder rolled back and down, we're gonna open up that carpal tunnel, and we're gonna help to relieve that palmar tension that we are creating when we grab the phone and type all day long, right? We can also wrap right around the thumb, start to stretch out this nice group of muscles on the front side of the palmar fascia, or the hand muscles right here. We're gonna stretch the thumbs open, and what we can do after that, work on extending the elbows, stretching each of the 5 fingers out nice and gently to help open up the carpal tunnel and all of the small muscles that we're using when we're typing so much, right? So, palms up, elbows in, shoulders back and down. We've done this all in probably every other video that we've shot. Head up when we text, and then nice little wrist stretch, which we call the complete flexor stretch, which we've also done in previous videos. That one was done on a wall, but if you're sitting down, you can very easily hit all 4 fingers, each individual finger, for about 5 to 10 seconds, straightening the elbow out, going through the same movement with the hand now, right? So this is text neck and text finger video. We're gonna shoot future videos on simple exercises to help combat the negative effects of overuse of cell phone, right? I'm Dr. Dan, we're over here at Turack Chiropractic and Beat Fitness. We'll see you guys in future videos.